Well, I'm joined now by Hugh Thomas of the drugs charity Barrow. Thanks for coming in. Why do you think we've seen such a dramatic rise in the use of ketamine?
Well, young people tell us that it's a more affordable option than other drugs such as cocaine or even using alcohol in pubs and clubs. Its accessibility, so particularly post-COVID, it's become very accessible via online methods and social media. Young people also tell us they use it to meet unmet mental health needs that they may have. And in some extreme cases, really, the young people will use it, and people will use it to manage the pain that they're experiencing actually from their ketamine use.
So it's a vicious circle.
It is, yeah. It becomes cyclical, really.
Now, we saw terrible side effects for Ollie there, the loss of his bladder. What are the other side effects?
I suppose for people using ketamine, if they start to experience things such as abdominal pain, urinary tract infections, particularly painful ones, pain whilst going to the toilet. And one of the most common symptoms really is frequently needing the toilet or an increased frequency in needing the toilet. If people using ketamine experience any of those things, we recommend they seek out support in services as soon as possible. They can seek support from their local substance use specialist services, or they can go to Barrett's web chat where you can be directed to your local services.
In England, bespoke ketamine clinics are being opened to treat people. Is that something you could see happening here?
It's something I'd like to see happen here. There's certainly been a rise in people accessing urology services for treatment. I think what we have in Wales is there's a lack of a clear vision really from Welsh Government around the treatment of ketamine. And I think what I'd like to see really is a new strategy. Our current strategy and delivery plan is out of date for substance use. And I'd like to see ketamine really have a clear pathway for prevention, treatment and support.
And what about reclassification? Would that help moving it from Class B to Class A?
I think in my experience, it probably wouldn't have much of an impact. People tell us that the classification has little impact as to whether they choose to use that substance or not. You look at the reclassification of cannabis recently from a C to a B, it's had little effect in terms of people choosing to use that.
So, really, I mean, Ollie is a salutary tale about keeping away from this drug.
That's right. I think what we'd like to do really is see much more prevention and education. So prevention of young people in the first place. We have services going into schools, universities, who are able to really talk around the harms and the associated risks of using ketamine illicitly. But also we'd like to see lots more training of GPs and primary care to really identify early those symptoms that people might be coming in with and get them to the right place for treatment early.
Okay. Hugh Thomas, thanks very much indeed.